All right, you're good to go.
Okay, hello everyone. My name is Dr. Christine Molmenti. I am an assistant professor of medicine at the Zucker School of Medicine at Hofstra, Northwell, and in the Department of Occupational Medicine, Epidemiology, and Prevention. I'm also an investigator in the Feinstein Institute for Medical Research and associate professor at the School of the Health Professions at Hofstra University, and previous course director for the course in epidemiology for MPH students. I'm also part of the Northwell Cancer Institute and currently leading the working group on early onset colorectal cancer. So it's a pleasure to be here today. Our topic is Blueprint to Fight Breast Cancer, Evidence-Based Recommendations and Practical Tips. And I'm going to spend the next 15 minutes or so just outlining a little bit about breast cancer, the evidence-based recommendations, and a few practical tips at the end. So breast cancer, almost all breast cancer are cancers of the epithelial cells lining the breast ducts. And the two most common are in situ and the majority are invasive breast cancers. Over 80% actually are in this category. The risk for breast cancer doubles each decade until menopause. And after that time, the risk for breast cancer slows. But interestingly, breast cancer is actually more common after menopause. We're going to talk a little more about that later. So breast cancer is the most common cancer among women worldwide. In fact, in 2018, there were over 2 million cases globally of breast cancer. In the United States, of the leading causes of cancer among women, breast accounts for 30%, and that's about 276 or so cases projected for the year 2020. And breast cancer deaths account for 15% of all cancer deaths among women, and ranking second of cancer-related death. The trends in incidence, and when we say incidence, we mean new cases of disease or risk of breast cancer. Here you see a snapshot of the two most common types of breast cancer, DCIS and invasive. And for DCIS in particular, you see a sharp increase from about the 1980s onward till the 2000s or so. And the reason for this was the upsurge or the uptick in mammography and screening. So more patients were diagnosed and more breast cancers were found. That's why there were more new cases in that period. In contrast, you'll see that for invasive breast cancer, there were declines, and some of that may be attributed to the decline in hormonal use among women, especially those over 50. You see this larger rise. The bright pink line is the 50-year-old women. And we see that decline in women over 50 because of the reduction in hormonal use. And then we see most recently, up until about 2016, we see that DCIS has actually been declining. And invasive breast cancer actually has been increasing since about 2004 at a rate of 2.1% per year. Some of that is attributed to the increase in body mass index or obesity and overweight among our population that may be driving some of that increase. So breast cancer is a hormone-driven cancer, and the breast glands develop during reproductive years and atrophy after menopause. And the breast tissue really develops in response to hormones. And there's a number of hormones that are associated with breast cancer, predominantly estrogen, but also progesterone, insulin, growth factors, and other factors. There are a number of windows of susceptibilities over time that our risk of breast cancer increases, and that women are more susceptible to certain risk factors or what we call exposures. So for example, from menarche or from the time a woman has their first menstrual period to menopause, there are a number of stages and various factors along that journey where a person may be at increased risk or potentially decreased risk. So one example is puberty, lactation, pregnancy, and depending upon your body mass index or your body weight or your waist circumference, over that period of time, your risk can change. And one of the most important windows of susceptibility is the time between a woman's first menstrual period and their first pregnancy. Between that time period, there is an increased risk for a potentially abnormal cell that may mutate to proliferate, or further, we call it cell proliferation, or these abnormal cells to further divide. And if there are exposures in that window between first menstrual period and pregnancy, those abnormal cells, because there's such rapid turnover and rapid development during that stage, there's more potential for those cells to become either precancerous or cancerous tumors that may show up later on in life. Other factors associated with breast cancer include adult attained height, weight, age of menarche, again, age of first period, and then age of pregnancy. These can all impact risk. And then the two most common time periods that are associated with breast cancer risk are the premenopausal period and the postmenopausal period. So prognosis of breast cancer depends on the status of the receptors. So all of our tumor cells carry receptors for different hormones. And the three most prominent are estrogen, progesterone, and HER2. And the presence or absence or combinations of these hormones can carry implications for treatments and what treatments are selected for patients, and then prognosis or outcomes and how well a patient does with certain treatments. And the presence, absence, or combination of these hormones also are associated with a wide biological diversity in behavior of tumors, meaning how do these tumors react to treatment? And some tumors may react differently depending on if they're estrogen receptor positive, negative, or progesterone receptor positive or negative, and then with HER2 as well. And then different cancer subtypes for these reasons may have different risk factors. So breast cancer is a very complicated disease. There's a lot of different risk factors. There's a lot of different time points. There's a lot of different windows of susceptibility. But what I want to cover today are just some of the main factors that we have a lot of evidence to show that how it impacts the disease. And so here's just a very brief graphic showing the cancer process. And what's most important to take away here is to see that we have host factors, and these are things that are related to the person themselves, their age, their gender, what does their genetic profile look like? What is their metabolic state? What is their inflammatory state and immune function? Their microbiome. This is becoming a major component of cancer risk today, is our gut microbiome. And then there's environmental factors, things that we may be exposed to, such as contamination of our food, viruses, UV radiation, different environmental carcinogens, things like tobacco smoke, other things that may be in our environment when we talk about exposure, and that may be secondhand smoke in this case. Then there's our diet lifestyle factors. These are all the things we ingest, our nutrients, our foods. If we drink alcohol, physical activity, if we smoke ourselves, and then a number of other lifestyle factors. So it's really a very complex disease and a complex set of exposures that may impact risk. And here we have our normal epithelium at the top here that goes all the way to an invasive cancer. And all along the way, there are different points of prevention and opportunities for prevention. So the thing that I'm going to really focus on are the evidence-based cancer prevention recommendations. And these are recommendations that have been developed by the American Institute for Cancer Research that have expanded across over 15 million people, over 3 million cancer cases in 17 different cancer types. And the American Institute for Cancer Research is really one of the most authoritative sources of data on diet, nutrition, physical activity, and prevention. There are literature reviews and systematic literature reviews that have been conducted by a panel of experts through the Imperial College of London. And the most recent report of breast cancer was published in 2017. And just to keep in mind that when we go through these recommendations, of the thousands of research articles that were evaluated for this report, they were really divided into a couple of different categories to help not only health professionals, but the public really understand the strength of the evidence. Some of the risk factors are really based upon strong evidence, and some have more limited evidence. And we're going to talk about that in more detail now. So for premenopausal breast cancer, there are a number of factors that decrease risk. Of those, there are 3 that strong evidence has been generated over, like I said, it's not just 1 or 2 studies, these are thousands of studies among thousands of people. And these particular factors have been deemed probable or convincing risk factors for breast cancer. So 1 is vigorous physical activity, 2 is overweight and obesity before menopause, and 3 is breastfeeding. The factors that have limited evidence that might decrease risk, but the evidence isn't as strong as the 3 I just mentioned, are non-starchy vegetables, especially in ER, estrogen negative receptor breast cancer, foods containing carotenoids, dairy products, diets high in calcium, and physical activity. The factors that increase risk in those with strong evidence, there's just one that has been identified over all of these different exposures, and that is the consumption of alcoholic drinks. In postmenopausal risk factors, postmenopausal breast cancer, we see similar factors. So the factors that have strong evidence for decreasing risk are physical activity, including vigorous, breastfeeding, overweight and obesity between the years of 18 and 30. And then the limited evidence is for non-starchy vegetables, foods containing carotenoids, and diets high in calcium. And the strong evidence for factors that increase breast cancer risk is the consumption of alcoholic drinks and overweight and obesity throughout adulthood. So you'll notice there's a little bit difference when we talk about overweight and obesity. In premenopausal breast cancer, we see that overweight and obesity before menopause and in the years from about 18 to 30 is actually protective and decreases risk for premenopausal breast cancer. It also decreases risk for postmenopausal breast cancer. But where we see the increase in risk is when we have overweight and obesity throughout adulthood. Because as I mentioned earlier, the breast cancer is more common in an older age group. And if a person is overweight and obesity throughout adulthood, meaning above that 30 plus year range, we really see an increased risk of breast cancer in that population. So I'd just like to expand on a couple of these today, and I'll provide information where you could look at these in more detail if you choose to. So the first recommendation is be physically active. And as I mentioned with premenopausal breast cancer, it's really vigorous physical activity where we see a decreasing risk. But the recommendation is really to be physically active as part of everyday life, walk more and sit less. The reason for this is you'll see in this figure, when we look at not only breast cancer, but endometrial cancer and colorectal cancer, these diamonds represent a decreased risk. And we see this decreased risk with more than 30 minutes of moderate to vigorous activity of most days of the week. When we talk about physical activity, there's a number, it's sort of a range of what physical activity looks like. And it can start from very little activity or someone who's pretty much sedentary, all the way to people who are engaging in moderate to vigorous physical activity on a daily basis. And the sedentary behavior is associated not only with breast cancer, but a number of cancers. And there's a whole literature on sedentary behavior, which is really important to understand for all types of cancer. So when we look at sort of the population of the US, we see that the majority of people spend about 10 hours a day in sedentary activities. And light intensity physical activity and moderate to vigorous is much less. And some of these activities include the following. Sedentary is pretty self-explanatory, but light intensity activity should not be underestimated because people who don't do a lot of formal physical activity, like go to the gym or work out on a daily basis, if they are generally active people who are shopping, gardening, walking around the house, maybe they have an occupation where they're on their feet all day, this should not be underestimated because light intensity physical activity is actually very protective for cancer in general. Moderate to vigorous physical activity for premenopausal breast cancer is very important for reducing risk. But these are things like running, biking, swimming, and vigorous activity. If you're engaging in vigorous activity, the recommendation is about 75 minutes every week. If you're just engaging in regular activity, it's about 150 minutes a week. And if you break that down, that's only about 30 minutes, 5 days out of the week. So if you can engage in 30 minutes of movement, whether that's light intensity or moderate to vigorous activity or somewhere in between, that's going to be very beneficial. So the next recommendation is to be a healthy weight. Keep your weight within the healthy range and avoid weight gain in adult life. So body weight is measured by a number of different factors. One is body mass index, which takes into account not only your height, but your weight. Then there's the waist circumference, which is another measure of your body weight, and your anthropometrics is what we call it. And then second and thirdly is your waist to hip ratio. And the reason that overweight and obesity is so important is that it's now causally associated with 12 different types of cancer. And as a cancer epidemiologist, we don't take the word causal very lightly because there are few associations between exposure and disease that are actual causal, that we can say one thing causes another. We know that smoking causes lung cancer. We know that HPV causes cervical cancer, but there's few other associations that we can say one causes the other. Obesity now is one of the factors we can say causes 12 different types of cancer. And these range from endometrial cancer and esophageal cancer, which are convincing. And in that list is the postmenopausal breast cancer, all the way to premenopausal breast cancer, which the data is still strong, but it's probable. It's convincing for postmenopausal breast cancer. And again, any number above 1 is showing an increasing risk. Limiting alcohol consumption. So for cancer prevention, it's best not to drink alcohol. When we talk about alcohol, it's important to understand the standard drink size. So each standard drink is about 14 grams of ethanol, whether that's 12 ounces of beer, whether it's an 8 to 9 fluid ounce of a malt liquor, whether it's 5 ounces of wine, or a shot of distilled spirits. Each of these standard drinks has 14 grams of ethanol. And we now know that alcohol is actually causally associated with 6 different cancers, and included in that list is pre- and postmenopausal breast cancer. So despite uncertainties about the effects of moderate alcohol consumption on non-cancer outcomes, drinking alcohol is not recommended for cancer prevention or any health benefit. And here we see, even at low levels, there's an increasing risk. So this data is based upon 10 grams of ethanol per day, which is less than a standard drink size. And so here we see that there's an increasing risk for not only premenopausal, but also postmenopausal breast cancer. And the data for this is strong and convincing. For mothers, breastfeed your baby if you can. So breastfeeding is good for both mother and baby. And there's more data on this in the report if you'd like to look at it. And then finally, eat a diet rich in whole grains, vegetables, fruits, and beans. And this data is limited for breast cancer. There is still more data that is required to provide a strong or convincing conclusion. But we do know so far that making whole grains, vegetables, fruits, legumes such as beans and lentils a part of your usual diet is extremely important. The impact of diet on breast cancer is especially associated with non-starchy vegetables, carotenoids, dairy, and a calcium-rich diet. For all these components, there's a significant inverse association, meaning as you increase these components in your diet, you see a decrease in breast cancer. And there's several different mechanisms of action to explain why this is plausible. Some of those have to do with tumor formation. If you think about a tumor developing, there is cell proliferation, there is apoptosis, which is loss of programmed cell death, doesn't function the way that it should. And there's a number of other factors that lead to tumor growth that are impacted by diet. However, the evidence is limited. We can't say that there's strong evidence, but there's limited evidence that looks very promising. And when we look at our diet and we think about these different foods that we eat, Every single fruit and vegetable, legume, or other plant-based product or food product that we may consume actually has a compound. They're called phytochemicals. And each different food that we eat may have hundreds of different types of phytochemicals. And it's the synergy among these chemicals that can produce an anti-cancer effect. And it's the synergy among these different foods, eating different colors of foods, different textures, different flavors, different spices. These can all impact our diet and produce a very important impact on prevention of cancer, not only breast cancer, but all types of cancer. And there's no perfect diet, but it's this synergy that really produces the effect. So a number of lifestyle tips to remember. One is a wholesome diet. This means simple, fresh, good quality ingredients, very limited processed food. And by processed food, this means foods that are in packages that contain either suboptimal fats, soybean oil, a lot of processed oils, a lot of processed fats and sugars that aren't healthy and don't contribute to cancer prevention. Increasing physical activity, decreasing sedentary time, adequate sleep, optimal body weight, low visceral adiposity. This is fat that tends to accumulate around the abdomen and the abdominal area that is associated with inflammation and the inflammatory process that is associated with a lot of different cancers when you have a low-grade systemic inflammation. Low exposure to environmental toxins, things in our environment, water that we drink, other things that may be contributing to our exposures, regulation of insulin, and a healthy microbiome. And then a few tips for sedentary behavior. I just touched on this briefly, but there's a lot of ways to reduce your sedentary time and to increase your physical activity. One is to stand instead of sit. So if you're on the phone, if you're at work, if you're watching TV, in meetings, trying to stand during those activities. Set a timer to break up long periods of sitting. So if you can set a timer for every hour to get up, walk for 15 minutes or even 5 minutes if you can all produce an effect. Increase light intensity activities or leisure activities. The best way to do this is to get a pedometer and try and shoot for 10,000 steps per day. If not, at least get 6,000 to 8,000 on most days of the week. And pedometers are fairly inexpensive and accessible and such a great way to monitor your physical activity. Standing desks, which are becoming more popular, and then take your book on a walk. If you're reading, can you try and find a way to do that while you're walking or doing some form of physical activity? The 10 cancer prevention recommendations, which you can find on the American Institute for Cancer Research website, are listed here. And what's most important to remember is that among 80 independent research studies, as the number of recommendations increases, the number of developing cancer decreases. So the more that you can adopt these different behaviors, the greater your chance of decreasing cancer risk. So that is all I have for today. I'd be happy to take questions. I'd be happy to schedule a visit. I have a prevention clinic through the occupational medicine department if you would like to schedule a visit, and would be happy to share any additional information that you may need. Thank you very much for listening.
Thank you.
Great job.